Welcome to the Art of Healing podcast. This is Dr. Charlyce, and today's podcast is how to test your hormones at home. I am going to be sharing with you a revolutionary tool that I don't even want to categorize as functional medicine or traditional medicine. This is a women's health tool that's incredibly empowering, and I'm going to be teaching you about that today in the podcast. So, for women, there are times in your life, more often than not, where you're going to question if what you're experiencing changes in your body for the good or the not so good are attributed to the changes your body is going through. And really, as women, well, men too, but as women, we are heavily influenced by what our hormones are doing, what our ovaries are doing, what our pituitary gland is doing at any time. But if you're experiencing things such as fatigue, weight changes, mood swings, trouble sleeping, temperature fluctuations, being uncomfortably hot, hot flashes, is hormonal testing right for you? Potentially, yes. Another time in a woman's life where hormonal testing can really help is if you are wanting to start or grow your family. So there are things that you can look for in your body without any indicators or testing. But this tool that I'm going to teach you about today really and truly can help. And I promise it is so easy to use in the comfort of your home that if you are planning for growing your family or starting a family, this tool really is an investment that I would highly recommend you use. In particular, if you are working with a fertility specialist, this tool, Mira, could really help. For the rest of us, monitoring your hormone changes may help you make decisions about your future, especially if you sense it might be time for perimenopause, or you're questioning if you're going through perimenopause, or you're quite sure you've gone through menopause and you've made sure to do a home pregnancy test and it's negative. There's other things that you can do to track what your body's doing that can really answer the question about where you are and what decisions you may need to make for your future. So, fatigue, weight changes, mood swings, disturbed sleep. And the key is that for women, we're taught in medicine that we start to look or question women's hormonal status at certain key times in their life. Puberty, as long as we see a child going through puberty naturally, we really don't intervene because we know what changes to expect. During the years of childbearing, when you're able to have children, for the most part, we think we know what we can anticipate, but for many women, it does not go that way. It is not going as predicted. They are not having periods. They are having unpredictable periods. How can we help those women, especially just not just birth control and just doing hormones just to suppress the symptoms? And then, of course, for women that are noticing periods that had previously been normal, but maybe they're not so normal, and they're wondering what is going on, that can be kind of difficult because they might see their doctor and get a snapshot in time with one hormone test that may tell them one thing, but it doesn't really explain what they're experiencing. So, hormone testing is something you can do at home. And a lot of people don't realize that for women, you've actually done quite a bit of hormonal testing at home. So the hormone testing you might do at your doctor's office, you go in, you get your labs drawn, you wait to get your result, and then that result's going to be a snapshot in time. Traditional lab testing may be a part of your medical care. It may be something you have to do without any choice, but it also could be that maybe an alternative would work for you. Especially for women, if you're going through hormone changes, you really need more than one test. Like testing for 1 month, just that one period of time, is probably not going to answer your questions. And also the cost, because a lot of those in lab tests can be expensive, and some of the ones that you may want especially trying to answer questions like, am I in perimenopause or am I in menopause, that may or may not be covered by your insurance. We've been doing home hormone testing in the form of pregnancy tests. Those kits are available everywhere. Ovulation kits, those are just basically an in-home hormone test. So we've had those for years, but what I'll be teaching about today can combine all of those into one amazing and in your home lab. And with this testing kit, you can do it when you see fit. It's integrated with a cell phone app that's extremely intelligent, that's going to guide you on when you should test. And it's so sleek that it'll even tell you if it's starting to sense changes, if it would recommend you do additional testing during a period of time, if you're monitoring for ovulation or if you're monitoring for changes in what's called FSH, if you are developing menopausal symptoms. And with this kit, you pay for your kit to start and the supplies to need, but every time you're testing, you're not paying for it. You already have all the supplies you need. The chart I'm showing here, and for podcast listeners, I will put a link in the handouts that include this chart, is just further a comparison of if you were wanting to do extensive hormone testing in a lab, which is going to be the snapshot in time. It doesn't really give you a lot of guidance about what's happening versus having something you could do at home where you could test on a daily basis and really make decisions in real time, whether it's trying to get pregnant or if you need to start hormone replacement therapy because you're in menopause. So I am introducing Mira. Mira is an in-home hormonal testing that allows you to test from the comfort of your home with the Mira, with the device and the testing strips that go with it. You can track your fertility because the mirror tracks certain key hormones on a daily or sometimes multiple times a day to tell you if it looks like you're about to ovulate or if you have ovulated or you have an ovulatory cycle. That's a cycle you did not ovulate. People with PCOS frequently experience those. And then Mira also allows you to track your symptoms along with this. And combining these tools together, it's extremely powerful. The testing is very simple at home, so it's very similar to conducting a pregnancy test in your home. So it comes with an easy to use cup that will collect your urine and you can reuse it. So that's nice because you don't generate more trash. The strip that goes with it or the testing kit, it guides you through how to test, and the app actually will coach you the whole way on how long to dip the strip into the urine and then how to put it inside of the mirror testing device. And then the device will generate a result for you that gives you a number. And at first, when you start tracking, it doesn't make a lot of sense, but the mirror is going to take that powerful information that it gathers over several days and it's going to give you some pretty insightful and powerful results. And it really starts to give you insight within a few days of tracking. So I had the opportunity to use the mirror for myself. So for me personally, the mirror was guidance as far as, am I approaching menopause? Am I perimenopausal? What are the next steps? And it was simple as these three steps. So the first step was you collect your urine and you hold the testing strip in the urine for 20 seconds, easy enough. So just like if you did a pregnancy test at home or an ovulation kit at home, then the wand that you test with will you recap it and you insert it into the mirror device. The device is handheld. And when I first saw it, I had doubts it could be as powerful as it was because it was so small and so convenient. And it comes in the cutest little carrying case. So if you had to travel with it, you could easily take this with you. So the device itself, it recharges. So you plug the device in. It's very intelligent. So once a wand goes in the mirror, after it's collected some info about you in the platform in the app, it knows what to do. It talks to the cell phone app that you have already downloaded. and it gives you instructions about what's going to happen next. The little surprises when I start using the device, I love that, I did my test, I put the wand in, and the first time I did it, it told me to go do some yoga while I was waiting for my results. I thought, you know what? I'll go do some yoga. I've got 20 minutes. I love that it gave me some little wellness to do. And I think it gives you other wellness tips for the 20 minutes. Then at the end of it, it starts hormone mapping. It's using the Mira app and it starts mapping your hormones. Now, for patients, this could look a little bit intimidating, but the thing with this Mira app is that you're not alone. It's backed up by gynecologists. It's giving you a lot of guidance. So you won't need to interpret the numbers. Once the app collects the data that it needs, it will tell you what's happening, and there's support by board certified gynecologists behind it. So, if you are interested in learning about the mirror, I will give you some links where you can start learning about it. Guess what? You do not have to work with me personally. You can actually sign up to get your own, but we'll get into that in a little bit. So, I'd like to offer a few quick hormone health tips. So, if you were thinking about doing the mirror, you're more curious, things you can do today to improve wherever you are as far as your hormone balance. Managing your stress, so meditating for 10 minutes a day, aiming for better quality sleep. One thing we want to make sure is that the room's not too warm. Our devices, I know for patients, that's a big culprit, is the TVs and the phones and everything. So maybe like try one night where you don't have them on. Making sure your nutrition, your food supplies what your body is asking for with each meal, always a good thing. And some kind of healthy movement. And for women going through hormone changes, it may not feel like a gym day, but maybe a nice walk in nature, or maybe yoga, like my mirror device instructed me to do, or maybe just even some qigong or something like that, but some regular movement throughout your day. So, your next steps, if you are at a place where you are feeling like having a tool to empower you is what you need. If you need this right away, if you're in the process of trying to start a family and you want all the help that you can get, I will provide the link where you can sign up, get your copy, and then the nice thing when you're getting it through me, you're actually getting a discount, a little bit of a discount. I didn't want to influence you too much, but there's a discount working through me. You can definitely ask me questions if you are curious about this device. If you need more guidance, you can email me. If you're listening on the podcast, you probably can see ways you can find me on social media. However, Mira, the company, has already got doctors that are certified and are supporting patients everywhere. So, although I'm a physician, you don't need me to get started. You can actually get started with your device right away. So, DM me or email me if you have questions. And then the resources I'm providing from today, I will provide a way that you can get started. I am accepting patients in my functional medicine practice, and if you're wanting a consult to actually get started on this, I'll provide that info. I am accepting patients only in certain states because we have to work where we're licensed, so that's, it's a little bit different, but otherwise, I'm available email, consult if you need, or you can get started right away. So, thank you so much for joining me for today's episode. We'll be getting back together soon. I wish you luck wherever you are on your hormonal journey. Thanks.